Dr. Robert McIver of Brooks Rehabilitation.
Thank you, everybody, for allowing me to speak to you for a couple minutes today on some topics that I'm very passionate about. My role with Brooks Rehabilitation is really to make sure that we stay cutting edge when it comes to technology and innovation. And so really working with outside vendors in order to help understand how to create new products. So really this is the innovative side of what we're trying to develop. This is before research, this is before patient application. We're just starting to dive into the world of virtual reality. So just as kind of an overview of virtual reality itself, is just it's coming. You know, you look at robotics, and robotics was a thing back in the 90s that was new and it was innovative and it was starting to get into the medical field. Virtual reality is the new robotics. It's coming. Our kids are playing in virtual reality worlds, video games, there's GoPros going out in the world. You can experience anything you want now by putting on a small headset, and you can go anywhere in the world. The other day, my son told me that he climbed Mount Everest. You know, I was like, wow, I haven't even gone out since the pandemic, and he's all the way out in Nepal. So just understanding that it's out there, it's coming, and it's a useful tool. There's a lot of new applications that virtual reality can really apply to the medical community and how we can use it. We just have to figure out how to harness it and how we can apply it to our patients and our current practice. So getting into current practice, this is where we are today. There's not really a lot going on in these pictures when you look at it, but it's really virtual reality. Virtual reality is a patient's ability to move, or an individual's ability to move and have that replicated in a different augmented place. So you think of a Wii gaming system, a Nintendo Switch, the Xbox Kinect, motion analysis, anything that's picking up what it is that you're doing in it and it's transposing it into a different environment, that's virtual reality. Now, virtual reality's changed a lot recently to where you now have your Oculus headsets and you truly can be in an immersive environment. And that's really where we're starting to move. But in our current practices, we're using those video games in order to enhance movement with patients. So we're giving a patient a controller inside their hand, asking them to hit a tennis ball in a virtual environment, whereas we may only be able to get them to, say, pick their arm up to 90 degrees in a clinical setting. But in a video gaming, people are competitive. They get angry. They get onto one another. They get competitive in a group. And so they start raising their hand higher. They start hitting things harder. And so we're seeing greater increases in strength, in range of motion from arms, better balance for patients because they want to participate and they want to interact. And the picture on the bottom left is actually a group of ours that we have at our center called the Spinal Cord Injury Day Treatment Program. They're not doing anything fancy when you really look at that picture. They're playing the Wii, they're understanding virtual reality, they're working on balance. The thing I really like about that picture, and you don't really notice from a far off stance, is that picture, in order to produce that group activity, required $250,000 worth of technology in order to allow those patients to participate in there. All in just a virtual reality environment. It's something they easily could do from home if we can make it more accessible. And you look at the Kinect, and then there's other pieces of, on the picture to the right, of where rehab technology companies are starting to come through with assistive technology, which that device over there actually helps the patient to lift their arms up, but allows them to be more productive in that virtual environment and allow them to gain more ranges just in what they're doing. And these are all advancements in the last 5 to 6 years that these technology companies are already starting to go through. The difference is the price tag is starting to go up with it. So that device that's holding that gentleman's arms up and helping him to participate in that game is about $120,000. It's not accessible for all rehab companies or all hospital systems in order to provide that level of technology and equipment inside a center for patients. It's something we want to give patients access to, and things that we've talked about here a lot today. Access to care at home, access to clinical expertise, access to chainsaws, all sorts of things that we need. You won the quote for the day, so you know. So the real barrier when we're looking at therapy is access to functional activities. So imagine yourself as a physical therapist, you're working with a patient that's new to walking, they just got out of their HAL robot treatment, they're starting to work on stepping, and you're working with them in a clinical environment, and you have that actual barrier to them, you're trying to get them up, stepping, moving. Okay, you have harnesses, you have help, you have people there. Now you take that patient and you want to get them out into the community. You give them an assistive device, you give them things to help clean up their home. But there's a big gap between when that patient is in the hospital and under my care versus when they go home. And there's a big safety part and a confidence of the patients. They're given this new tool. They don't really know how to use it in an environment without somebody supervising them. Or they have, something new, an environment they haven't experienced yet. They're getting inside of a car and trying to drive with something that's other than a gas pedal. So how do they do that? I have the utmost empathy for all of the adaptive driving, people who train those patients, because the first time you get in with that car with that patient with that controller, most time it's the first time they're driving in about 7 to 8 months, and it can be a hair-raising experience. I've just seen a couple of them go on. But it's something that has to be done. The patients have to get back to function. We have to get them back into the community. So there's no real easy bridge from it. And this is where we really see that virtual reality as an immersive experience can really go to help bridge that gap. So what we started looking for is we looked for a partner. And we found a partner in Vera Enterprises, which is based out of Dayton, Ohio. The individual there, he is a software engineer, and he develops virtual reality applications for installation of complex soundboards in stadium and different types of events. I won't speak too much to it because I'll embarrass myself with that part. But it's all about simulated training of how do you assemble these boards inside the field. So their workers come in, they go through a simulated training in a virtual reality environment of which screws to put where, which light bulbs to put where, and how to go through and assemble and make the board work the way that it's supposed to and be effective. So we thought, why not apply that into rehabilitation? Why can't we give the patient all of the tools that they need inside a virtual environment in multiple different applications to practice, in order that way they can practice in a safe environment, they can understand what they're exposed to and what the expectation is when they return home. We have simulation labs inside medical. I know Brooks has one, Mayo Clinic has one. I'm sure other facilities have simulation labs that we can simulate any sort of environment that we want, and we're in control of that environment. But still, it's expensive and it's costly. And then, to my thinking of it, if you're going into a simulation lab in a hospital room to simulate an emergency event, you know it's coming, you know what's happening. There's no real randomness to it. In a virtual environment, we can control all of it. And so we worked with the engineers here and developed a training software that allows a VR world that we can control. So I am in control of the game, I'm in control of everywhere. I told my wife that one day, and she said I felt like I had a God complex. I was like, oh, maybe. It's nice to be in control of something sometimes at home. But just getting them to be able to understand. So what we worked on with Vera Technologies is our first platform. So we're actually making a Brooks Oculus store. So we're developing a store that has different applications of virtual reality for multiple things, for patients and for training. So that way it just goes out into anywhere. So Oculus is $400. You have it, you can put it in a center, you can put it in a hospital room, you can have different access to it of patients in different levels. But now you have a selection of specific activities that you want your patient to perform or you want your employee to perform. So what we started with is developing a game. So that's what you see on the right there, and that's actually our boxing game. So we have a game where we can simulate a true boxing environment for our patients. We can do training, or we can have them actually boxing against another individual. And what that has is I have the ability to control where the punches are being thrown, where the patient has to stop the punches, where they have to move, when they have to duck, and it's also it's measuring the range of motion in real time, telling us what sort of balance reactions they're having, and allowing them to move from there. So it's really getting that patient in that immersive environment. So we have more projects that are going on, so 4 current projects that are happening. So one is our Google Earth integration. So getting patients used to their overall community. So through Google Earth, we can actually take that Oculus headset, put them out into their neighborhood, into their community, and actually let them walk around, explore what's happening, see what's going on in there, with the hope that we'll be able to implant or superimpose the blueprint of their house on top to work on navigation inside there, using things like a wheelchair controller or anything else that we can add into the Oculus world. A theme park simulation. So this is great for kids with sensory issues or sensory things that we're trying to work on with them. So we can actually introduce them into Disney World without any people or any lines or any rides or any stimulation, and then gradually add in those stimulation pieces for the kid to go through and try to see how they respond to these situations and what is it that we need to work on in therapies to be more specific. Adaptive driving is one of our programs that we're working on. So we're working on getting into a simulated world where we can actually simulate reaction time. We can look to see how they utilize the current assisted devices in order to drive, but also just to get them out and understanding what they're doing before we actually put them in the car to go through the official training. And then the other piece is having interactive rooms. Pandemic really brought that to light when we had patients that couldn't interact with one another in specific areas. Well, now you have the ability inside these interactive rooms where you can go in, you can talk to one another, you can play, you can write on boards, you can have meetings. So lots of different options that we have when it comes to virtual reality and where we're going. And glad to say, or happy to say, that we're on the forefront of that and that we're starting to move this forward in the Jacksonville area. And I hopefully can come back to you next year and tell you more of the areas of where we are and where we'll be conducting our research. Thank you.